My patient's pain medications could actually make their pain worse? Yes, that is correct. This is called opioid induced hyperalgesia and is a poorly understood but real phenomenon experienced by some persons taking opioids at higher doses. So how do I know if my patient is experiencing opioid induced hyperalgesia? Unfortunately, that is less clear. Opioid induced hyperalgesia, or OIH, is frequently confused with tolerance. Tolerance refers to the need for increasing doses of a substance to elicit the same effect. You can see why this might be confusing to both the patient and to the prescriber. Opioid-induced hyperalgesia refers to a paradoxical response to opioids, in which the patient actually becomes more sensitive to certainly painful stimuli. Additionally, the underlying pain condition may significantly change characteristics and even location. Some common signs suggested of opioid-induced hyperalgesia include worsening pain over time in spite of or because of increasing opioid doses, lowered thresholds for pain, also called nociceptive sensitization. The area or areas of pain become more diffuse or widespread. Or lastly, pain changes primary characteristic and is harder to localize. For instance, pain previously described as aching, throbbing, or stabbing may now present as burning, numb, radiating, or pressure. So how should we approach suspected opioid-induced hyperalgesia? That's a tough question. First and foremost, patient education is the key. It's incredibly counterintuitive to think a pain medication can be contributing to the pain experience. Having the patient understand and be on board with opioid-induced hyperalgesia as a concept is absolutely crucial. The next step involves either a slow or thoughtful opioid dose wean, or rotation to another opioid using equal analgesic dosing conversions. There is no data to suggest one method works better than the other. Some patients on higher doses of opioid may require a prolonged wean over months and even years. Other patients may not tolerate a wean at all, potentially leading away from opioid-induced hyperalgesia as a consideration. Either way, opioid-induced hyperalgesia is a potential adverse effect of opioids, especially at higher doses and when used for long periods of time. Shared decision-making with a well-educated patient should preclude any attempts of opioid dose reduction as a method for addressing suspected opioid-induced hyperalgesia. This prescribing tip is brought to you by the Southern Illinois University Edwardsville School of Pharmacy and the Illinois Prescription Monitoring Program.